right, today I want to talk about I know everybody's sick of the coronavirus, but this is kind of important. Um, when you have the senior director of the WHO actively
A senior WHO.
snubbing a reporter when she's asking him about Taiwan. And it's just incredible how in the pocket these people are for China. And it's all about the Benjamins, man. All about the Benjamins. So this is the WHO, the leader, the guy who we're taking all of our advice from, the guy who is telling us how to do what we do, and how wonderful China has been with us, and how awesome that if he ever got corona, he'd want to get treated in China. Okay, dude, I hope that happens. I really do, because I'd love to see it. I'd love to see what happens to you when you get treated in China for this virus, because we all know China's lying through their teeth. China's lying through their teeth. And I mean, it's just obvious. And now that the Americans have more of a, it's a outbreak more in America. It's making China look better. I guess they can point the finger and say, "Yeah, see, America, it's a dangerous place. Nobody wants to go there. It's a dangerous place." See, China's government is wonderful. We've taken care of this problem. We have taken care of this problem, and now we don't have the numbers that we used to have, because we're China. We're the CCP. We do what we need to do, and it's just disgusting. It's disgusting. So, anyways, if you haven't seen this clip, it's just amazing how this guy treats this reporter who asks him a simple question. I mean, it's really it is a simple question. It's just answer the damn question, dude. What's the problem?
WHO considered Taiwan's membership.
Nothing. Crickets.
Hello?
I'm sorry, I can't hear you. I couldn't hear your question.
Okay, yeah. Let me
dick.
repeat the question.
No, that's okay. Let's move to another one then.
When
What
Islewood was asked about
dick.
Taiwan, he
Can you
stalled
believe
for
that
close
shit?
to 10 seconds and avoided a reporter's question. But the reporter persisted.
I'm actually curious on talking about Taiwan as well, on Taiwan's case.
Then he reaches over and he hangs up. And she's sitting there going,
We decided to
What?
give Dr. Alward another call to follow up.
And I just want to see if you can comment a bit on how Taiwan has done so far in terms of containing the virus.
Well, we've already talked about China.
Islewood is an assistant director general at the WHO and is a Canadian-trained epidemiologist. Ever since the pandemic broke out, he has constantly sung China's praises.
I left inspired and with a deep admiration for, the common Chinese people that
see
I
that-
worked
you
with.
see
If
that-
I had
that-
COVID-19,
that
I
sign
want to be
right
treated in China.
Lin Shejia,
sign on the back
the
there,
CEO of the
that's
Foundation
a
of
dollar
Medical
sign.
Professionals Alliance,
Not a snake.
lamented
It's a
that the
dollar
WHO has been deeply poisoned by Chinese influence. He said he believed that once the pandemic was over, each nation would seriously consider how to reform these kinds of international organisations that have been heavily infiltrated by China.
So there you go. There you go. But can you believe that shit? This is what we're these are the people that we're taking our advice from. We're getting our medical advice. It's the same people that also said that that closing down our borders was racist and there was no need for it. No need to stop trade and stop travel to China. There's no need for it. because it's racist. Everything's racist. And now both of our economies are about ready to get decimated because these people are fucking idiots. Sorry. But they are idiots. And it's a shame. It's a shame. I've been to China twice. And I loved it. I loved it like there was no tomorrow. I want to go back soon. I'd love to go back soon. Because it's a beautiful, beautiful, beautiful country. Beautiful people. Absolutely beautiful, sweet, wonderful people. I love them. I love China. But that government, boy, that government's got to go. It's got to go. Because it is rotten. Rotten to the core. And now you absolutely think that China's numbers are right. Sad. I have a girlfriend that lives in Chengdu, which is the upper northwest of the country. So they didn't get hit too hard. They had a spread a little bit, but it wasn't horribly bad. It wasn't hard. Wasn't too worried about her, but, it was bad enough where she's been out of work for 3 months. And now she just started going back to work, so there's a little anxiety going on there, I guess. But I've been watching this since the beginning, and man, so much to say about it. I don't even know where to begin. This is not a very good one, a very good topic to start on my first podcast. But yeah. But that's about all I got right now. I didn't do too much research because I don't know. I mean, this video boggled my mind, and everybody else has already said whatever there is to say pretty much about this thing. So I just wanted to test things out, do my first one. I don't even know how long I've been going for now. How long have I been going? I don't know. It doesn't say. I can't tell. I gotta fix that. But yeah, this is crazy. Crazy. I've been out of work for 2 weeks. Hence the reason why I'm starting this podcast. From sheer boredom. So better than staring at the four walls every day. And yeah, who knows? Maybe I'll do it a little bit at a time and get better at it, and then we can make some money. Maybe, I don't know. I have no idea. I have no idea what to do. All right, for the next clip, there's a bunch of news reporters in New York saying how long the lines are and everything in the at the Elmhurst Hospital, that people are struggling to get care there because the lines are so long, and that there's not enough doctors, not enough beds. But in reality, there was a bunch of people that went out there and looked for themselves, and this is what they captured.
Going away. The demand is still there. It's not slowing down. As you can see behind me, this line, John, has started forming even earlier this morning, and it's even longer at this hour. People waiting in the cold to get care. The hospital tells us every day they're working to increase the capacity of this hospital by flooding it with nurses and doctors and equipment just to keep up with this demand.
I've been here for an hour. Not one person has walked up to the tents. Not one.
There you go.
Okay? So, and look at all the ambulances down the block. You see any ambulances?
Somebody else take a video.
Look at, more people are taking videos. because no one's believing the fake media. You see all the ambulances that are on the block down there? They're all parked. They've been there for an hour.
Elmhurst Hospital in Queens is now the epicenter of the 5 boroughs. So many people lined up to get testing, confirmed cases there. Doctors and nurses are inundated.
Elmhurst Hospital, as you said, has really become the hot zone. Every single day, patients are lining up outside here, many of them with cold and flu-like symptoms. They come here to be tested.
I'm standing outside of the Elmhurst Hospital Center in Queens, New York, and according to the media, this is the epicenter of the apocalypse, but it sure looks like a ghost town to me. Look on the YouTube, the CBS News, long lines of people trying to get tested. I don't see that. Oh, here's those tents they had set up. This is what you saw on the news.
With the growing number of patients as supplies dwindle. You can see barricades behind us set up here outside of the hospital to keep order here because so many have been lining up every day to get tested.
13 people have died at this hospital in Queens, while outside it's swamped with New Yorkers waiting in long lines to get tested for the coronavirus. The numbers in the city are still rapidly growing, but the nation's top infectious disease expert says studying what's happening here could give clues to help reduce infection rates in other parts of the country.
It's accelerating. There are other parts of the country which we need to get a better feel for what is going on. And the way we do that is by increasing testing and identifying people who are infected, isolating them, getting out of circulation, and then do contact tracing. It doesn't matter what you say 1 week, 2 weeks, 3 weeks. You've got to go with what the situation on the ground is.
So, just to stop it here, why are they doing this? Why are they making this sound so bad, the news, the media, making this sound so bad? And that's because Cuomo is trying to get the government to give him 65,000 respirators. 65,000 respirators. And President Trump is like, well, it's a little bit much. I don't think you need that many. And so that's what this is all about. It's the news media hyping things up again and lying to your face once again. But this stuff isn't working anymore because we have cameras of our own. We know what to do. We can go out and do it on our own citizen journalism. And there's plenty of people out there right now taking videos and posting them and saying this is all crap. I really don't understand anybody who listens to these people anymore. If you watch CNN or MSNBC or even Fox News for that matter, you're a lost cause if you believe these people. It's like talking to a battered woman. You know, you sit there and she comes into work every day with a black eye, and it's like, why are you still with this guy? And she just comes back and says, 'cause he loves me. Oh, I can't leave him. He loves me. It's ridiculous. So it's all about money. It's all about money. Look at long lines of people. Somebody's walking through the hallways. Empty. Look at nobody.
I don't see anything wrong.
Nobody. probably less busy than an actual regular day. But it's all about money. Money. That's the scary part, because you've had two administrations trying to pass government health care, national health care. Now all of a sudden you have 10 million people out of work. And this is what I always said about when the Obama administration was going through this. He would always tout this number of 30 million people don't have health care. 30 million people don't have health care. This is why we have to pass this national health care. It's a crisis. 30 million people in this country do not have health care. Well, if you think about that for 1 second, there's 300 million people in the country. He raised the unemployment rate to 10%. So he wasn't lying, because the only people in this country that doesn't have access to health care at an affordable price is people on unemployment. Now all of a sudden we have 10 million more people on unemployment. Well, obviously we're going to have to now you're making Bernie Sanders look good, because instead of fixing the problem with the and this is something I've been saying for years, instead of fixing the problem with unemployment insurance, because you always heard it's the poor, we want to help the poor. Well, the poor have Medicaid or Medicare, whichever one, I can't remember. But the poor are covered. Anybody who has a job can be covered. Yes, it's just way more expensive than it needs to be, obviously, but that's because the government's got their hand in everything and is necessarily making the prices skyrocket, because now they're mandating that these insurance companies cover all this other stuff that doesn't affect me, doesn't affect most of us. But now that they have to cover it, they've got to charge us for it, and we're paying for all this other stuff. I've always liked the idea that I think it was, I can't remember, Ted Cruz or somebody like that always said that if why can't I buy my health insurance like I buy my car insurance? So if I'm relatively healthy individual, if I'm a relatively healthy individual, and I don't need some kind of medical thing, I can buy catastrophic insurance. There's 18,000 different insurance companies in this country, and I have to take what my employer gives me, and my employer can choose from what? In New York State, from what? 4 different companies, maybe 3 different companies. And then he has to fit into this little bubble of how many employees he has and what he has to work with. And now he's kind of pigeonholed into these plans that he can offer me. And there's my employer was pretty good, so he offered 4 different kinds of plans. But most places don't even offer that. They offer one plan. You can take it or leave it. This is what we offer. This is what we give you. This is what everybody's going to do. Instead of not having my employer worry about my insurance at all. And if I find an insurance company down in Missouri that has the right coverage that I'm looking for at the right price, then why can't I go there? And that is the government control that needs to go away. That's why our healthcare is so expensive. And of course, after they started talking about this national health care and everything else, obviously somebody's got to pay for it. And basically all the insurance companies were the ones that wrote these things. They helped write all this stuff, which is, I don't understand. It's going to kill the insurance company, but yet the insurance company helped write these bills. Ugh. Well, when you're looking at some of this stuff, especially when it comes to the mainstream media or dinosaur media or fake news, whatever you want to call it, you either have to use discernment or you're going to be given over to delusion. One of the two. And not enough people have discernment anymore. They post something on Facebook, they think they're journalists, or they read something on Facebook and they think it's real. I learned that early on. I learned that. And, even when I talk about 9/11, there's all these other theories like energy weapons and Mothman or whatever. This is just stupid stuff, just absolutely stupid stuff. And I try to tell these people, it's like, dude, you don't even have to take it that far. I mean, Building 7 is pretty bad, but you don't even have to take it that far. Just show them a couple of pictures of the Pentagon when the plane went into the Pentagon, and they have these aerial shots of the firefighters and everything down on the ground, and there's no scrape marks in the ground, none. Just show them that picture, and it should just click. It should click. That's as far as you got to take it. I don't know the whole story. There are some pretty good accusations out there, but I do know, as soon as you say something like that, then people think you think that George Bush was around the corner with a plunger, like the Wile E. Coyote blowing up the buildings. It's like these people are idiots. I can't even take it. I can't take the non-thinking. I can't take you using a little discernment and having a somewhat intelligent conversation. I mean, you are talking to me, so it can't be that intelligent, but I mean, you have to have a little bit of common sense, you know what I mean? But so that's about it for now. I don't know. Sometimes if you haven't seen the thing about if you haven't seen what the Georgia Guidestones are, go check those out, and the murals in Denver, some of that stuff is like pretty wacky, and it's just, those are the things that make you go, huh. Not saying anything is attached to any of that stuff. I'm just saying it just kind of makes you go, overpopulation and, all this population control. Bill Gates talking about controlling the population with vaccines. I don't know. If I had the wildest thought in my head the other day, it was, I'm not really scared of this round of the coronavirus, but if it was manufactured, if I have no idea, but if it was manufactured, and it was released on purpose, which I don't think so. I mean, I've seen some good evidence that it was an accident. But even if it was an accident, if this was a manufactured virus, they sure tested it to the fullest of extent of how fast it could be spread. And maybe the next one they can use it for the carrier of the next thing that comes along. And that might be your zombie apocalypse, actually. That could be your zombie apocalypse. One thing I do know is this coronavirus, this COVID-19 strain, the Wuhan flu, is out there now. So it's probably going to be a thing for a long time, like the flu. And they're going to tell you, oh, get your vaccinations every year, just like they do with the flu, but they never get it right. So, I don't know.
Effectively flat for 2 days. While none of this is good news, the possible flattening of the curve is better than the increases that we have seen.
All right, so that's good news. Finally. We might have a flattening of the curve for the amount of cases in New York City, which is good. Of course, where I live in Syracuse, it's gone up quite a bit, so I don't know if it's flattened out here or not, but it seems like it's going to be good news. We'll see. Hopefully we can all get back to work and get back to normal again pretty soon. So, yeah. Basically, this was a test because I got a new light. So, I'm going to put them all together, and I'm going to put everything together and see how well it looks. I might have to do a little finagling, but it looks pretty good.